I'm Sandra Morris.
I'm Tyler Houston.
And I'm Katrina Doherty, and we'll be presenting on AAC assessment and treatment of patients post-TBI.
Okay, so first we want to define AAC. And AAC is an augmentative and alternative communication. It's a device to any form of communication other than oral or speech that an individual uses to assist the person in expressing communication of their thoughts, wants, or needs. And it's also to enhance one's communication and help facilitate oral speech. There are specific AAC devices such as picture and symbol, and communication boards, and electronic devices tailored to each individual. This individualizing is designed to help facilitate and increase social interaction, school performance, and feelings of self-worth. Traumatic brain injury is caused by sudden damage. A few examples that can lead to a TBI diagnosis is car accidents, falls, or violent assaults. Consequences of a TBI may include physical, sensory, cognitive communication, swallowing, and behavioral issues. So an SLP assessment for patient with a TBI referral for AAC evaluation first would be the case history, such as getting the medical status, education, occupation, SES, and cultural and linguistic backgrounds of the patient, and post-TBI auditory and visual results, individualized reported concerns, and their motor abilities, such as gross, fine, range of motion, strength, and hemiparesis. Current mode of communication, literacy skills, intelligibility, expressive and receptive language function, cognitive function, patient's potential and desire to return to prior level of function, and activities of daily living. So then next would go to the treatment. And treatment for TBI patients may vary greatly among individuals. Every individual's TBI is going to be unique in many aspects, such as a lesion size, location, or brain length without oxygen. These many variables and junctions with differences among all humans makes it for every TBI to be vastly unique. And we should keep in mind of brain plasticity, which is the brain's ability to modify which will also play a role in AAC treatment in TBI patients. AAC use by people with TBI effects of cognitive impairments. So this article discusses the change in treatment with AAC devices among TBI patients as their diagnosis improves.
Now I'm going to talk about treatment through recovery. The ASHA leader presented a discussion by Doyle and Frazier called A Framework for Discussion, AAC and Intervention. This article discusses a breakdown of appropriate AAC methods for TBI patients based on their cognitive functioning as measured by the Rancho levels, stage of recovery, and purpose of rehab. The three classifications are emergent communicators, transitional communicators, and long-term augmentative communicators. So the first one being emergent communicators. These are the individuals that are unable to speak due to their cognitive and respiratory or medical status. The AAC devices that are designed for them are ongoing and cognitive and language assessment based. The devices are unaided or low tech. Some examples are yes-no response systems, object choices, simple communication boards with 2 or 3 pictures, and then single message voice outputs. These AAC devices may change as cognition, language, or motor skills improve. Our second level is transitional communicators. These are communicators in early or middle stages of recovery with improved awareness, comprehension, automatic speech, and a desire to communicate. The majority of these devices are low-tech or unaided. Examples are redesigning and upgrades to accommodate changes, picture word communication boards, writing or alphabet boards, and speech generating devices. Our last level is long-term augmentative communicators. These are typically in the middle or late stages of recovery. Some examples are spelling-based text-to-speech. They can be used in non-structured environments. And then the ones that people want to use, like iPads, are usually convey basic needs, and they may be stylish and accepted, seem to be socially accepted, but they have limited functional communication tools. So we like to stick to things like the Tobii Dynavox. Some goals for AAC are to increase the use of AAC with functional context, increasing participation in schoolwork and community, and then there's a couple more listed. So these are the 3 levels based on the treatment through recovery.
Now we'll discuss the use of AAC devices for persons with aphasia. In 2010, Wallace conducted research and found that the use of high-tech devices can help to elicit communication and reduce cognitive demands. She found that high-context images typically provide more information because they convey content beyond that of simply identifying single people, objects, or concepts. For example, viewing a high-context image displaying a person opening a bird cage to care for a bird may more clearly trigger the intended association with pets than a simple image of a bird. This can also help elicit communication for persons with aphasia who have issues with word finding. Now we'll be discussing a case study provided in the slide. The individual's name is JB. He's a 23-year-old male who is diagnosed with a TBI due to ATV accident. His assessment found that his hearing was affected in that he had minor tinnitus. His vision was normal. Motor ability is normal. He did have issues with memory deficits, and he was diagnosed with Broca's aphasia, which makes him non-fluent, anomic, and he fatigues easily while talking. He's a male who's interested in anything sports and outdoors related, and he attends Awilka University for computer science. So we thought the use of a high-tech AAC device would be best for him, particularly because he has aphasia, which in the previous slide we discussed the use of AAC devices for aphasia to help elicit more speech. And also he's tech savvy since he attends a university and is a major in computer sciences. Some of the goals we have listed are for his short-term goals. The patient will label a tangible object core word with a single noun symbol during 10 out of 10 trials. The patient will label a familiar concrete core action word during 10 out of 10 trials. And the patient will verbalize understanding of medication regimen in 10 out of 10 trials. And so in having a high-tech AAC device, all of these things could be done easier and can reduce some of the cognitive demands that are placed on him. Some of the long-term goals are the patient will independently analyze errors in communication interactions and devise strategies to address it with the use of his AAC device in 90% of the time. 90% of the time, the patient will demonstrate written expression skills at the basic sentence level with 90% accuracy for home, community, and medical and safety needs. The patient will demonstrate the ability to express functional wants and needs at the basic conversational level via multiple modalities, for example, verbal, AAC, and gestural with 90% accuracy. And that is our presentation. Thank you.